Hi, Dave Butler here with Align Therapy. I'm here with Bea, who's one of our awesome patients here at Align Therapy. We are going to demonstrate our top 3 exercises for core strengthening when you have low back pain. And low back pain is very common. You probably know someone with back pain. You probably yourself have back pain if you're watching this video. Very prevalent, but there are a lot of things that can be done. A lot of times we just kind of put up with it and we just live with it, when we don't necessarily need to live with back pain. There are plenty of things that can be done. Just a caution, if you're having back pain with any of the exercises that we do today, I want you to make sure that you are stopping doing that exercise and asking for some help from somebody who knows what they're doing. Ideally someone who specializes in back pain so that they can help you get on the right track to get your back pain solved. So the first exercise we're going to do is a bridge. A bridge is a very simple exercise. It's kind of a hip hinge exercise. So Bea, go ahead and lay on your back. It's a very functional exercise as well. The way that I usually start with a bridge is just bending both knees. And then with the feet about shoulders width apart, you just raise the hips off of the table. So good, go ahead and go back down. We want to do this in a controlled way. Some people talk about segmental bridging, where they try to take each segment of the spine one at a time up. I think keeping a little bit of tightness in the abdominals as you raise your hips off of the table is helpful so that there's stability as we do this. If there's pain as you go higher, stay below that pain and kind of work the muscles in that lower range of motion. One thing that I want my patients to do is I want them to be aware of which muscles are active. So we're going to ask Bea to tell us which muscles she feels working as she's doing this bridge.
I feel my core a little bit and my glutes and my hamstrings.
Perfect. So we want the glutes. The glutes are the drivers of this exercise. The core should be there to add stability. Then the hamstrings in this position, a lot of people will feel the hamstrings. One thing to be aware of, a lot of people have muscle cramps in their hamstrings when they do this. Especially older individuals will have muscle cramps in their hamstrings. If that's happening, there's an easy solution to that. We can take a ball, let me grab a ball here, and we can put that underneath the legs. This does 2 things. It puts the hamstrings at a longer length so that they're not cramping. The ball also creates some instability, so when we do the bridge, we get more muscle activity out of the core muscles. So go ahead and bridge up. Perfect. And back down. So I don't want them to fall off of the table. You may want to do this on the floor. She's doing a great job at this. Do a couple more. You'll usually feel a little more in the hamstrings with this, but they shouldn't cramp with this. If you're feeling a lot in the hamstrings, an easy thing to do is bring the ball closer to you. So the closer the ball is to the knees, even closer than that, let's go closer, there you go. Then there's not as much of a lever for the hamstrings to work. So go ahead and raise up again. So we shouldn't be feeling as much hamstring as we do this exercise. So this is a way to take those hamstrings out, to make it more challenging as well. You can do this with your legs up on an ottoman at home or on a couch, or put a chair on your bed. It doesn't really matter, just bring those legs up. It also makes you go through more range of motion. So great, you can still that. Exercise number 2 is one that most people know about and most people dislike. I don't know if I think Bea really likes
I do
planks.
like planks.
So the next one is a plank, just a general front plank. So go ahead and lay on your stomach. We're going to do it up here. On the elbows and on the toes is where I usually will go. Go ahead and come up into a plank. A few things that I'm looking for. I'm looking for that the back is relatively straight. So I don't want here in the low back to be arching down. So go ahead and show me that. Yeah, we don't want this sagging down, so bring that back up. And also through here, we don't want in between the shoulder blades to be sagging down, because we want stability up in the shoulder blades as well. Bring this up a little more, right there. So we want that to be nice and straight. Then you just hold it. And as long as you can hold it while keeping good form and without back pain. If there's back pain, you stop. some people, when I do this, I'll feel it a lot in my shoulders. A lot of people feel it in the core. You're going to feel it all different places. I wonder how long I can talk and keep Bea here while she does a plank. Just kidding. But we're getting contraction of the muscles on the back side and on the front side of the core. Great core exercise. Good, yeah. There are many variations on planks. You can move your legs. You can do a plank with your arms up on a ball. Don't do that on a table, by the way. There are many ways to make planks more challenging and to have more benefit, but this is the lower level. The lowest level of planks, go ahead and do this again at your knees. So if you keep your knees down, we're still looking for the same position of the low back, but now there's not as much force on the core muscles. So this is easier. You should be able to hold this longer. Usually when I get to about a minute and a half or a minute with this exercise, I'll switch to a full plank. And then for a full plank, I'll keep going until they get to a minute and a half with that, or 2 minutes. And then we'll start changing it up, challenging them a little bit more. So, good, perfect. Go ahead and lay on your side. Okay, the third exercise for back pain, the hips. Go and put that on those legs. The hips are part of the core muscles. A lot of people think that the core muscles are the abdominals. That is not true. The core muscles are all the muscles around the core, the back muscles, the side muscles, the hips, and a lot of times they're neglected. A lot of people neglect the hips. So this is a clamshell exercise. This is exercise number 3. And a clamshell, you lay on your side like this, and your hips at about 45 degrees and your knees at about 90 degrees with your feet together. And the idea with this is, it's called a clamshell because it's like you're opening a clam. So you pull this top knee off of the bottom knee and up and back. One of the things to be aware of is we don't want the body to roll back with this. So if it's too hard or there's not mobility in the hip, what we'll see is, on this next one, we'll see them roll back like this to try and get that range of motion. We want the hips to stay stacked. We want the feet to stay stacked, and the knees are just coming apart like that. You should feel that here in the glutes, kind of on the back side of the glutes. Should feel kind of deep in the piriformis and some of the, like the glute med and the other muscles. Getting tired, yeah?
Yes.
Yeah, feeling this, okay. So this is a great exercise to increase hip stability, which should help increase low back stability. If there's pain with this, back off and make sure you know why that's happening before you continue. So those are our 3 exercises. We've got our plank, we've got our bridge, and we've got clamshells. All 3 of those are great strengthening exercises for those with back pain. Remember, if you have pain, back off and contact someone that can help you figure out why and what to do. Thanks for watching, and hopefully this was helpful. Thanks, Bea, for being a model.
Thank you.
And we'll see you next time.